Now, this is the flow volume curve. In this, two things you have to remember. First thing is that this is the expiration. This is the flow volume, not pressure volume curve, right? This is the point where the residual volume is going to be shown, and this is the place where the total lung capacity will be shown. So please remember, from the RV to TLC, that means this total is going to be, RV cannot be measured. I don't know what is the end point of it. This is the RV. That means what this point I'm showing is going to be the end point of RV. From RV to TLC, it is going to be the vital capacity which will be measured, right? Now, on the top, you are going to have expiration. And the second thing I want you to notice over here is that as we are going to go from the right hand side towards the left hand side, the volume is increasing. It is reverse that of the most of the graphs, right? Now, please remember the first part of expiration, it is going to be effort dependent. D comes first, right? And then comes the I. And this part, the later on part, is going to be effort independent. Effort independent. And the inspiration is going to be in the downward segment. Now, please remember, these are the flow. This is not the pressure volume curve, right? So, where the flow is going to be maximum or it reaches its peak, I'm going to call it as peak. Either peak expiratory flow rate or peak inspiratory flow rate, depending on whether it is measured in the expiration or inspiration. Peak expiratory flow rate, peak inspiratory flow rate. If I just make the four parts of it, the 25 to 75%, this middle one will be called as MEFR, that is mid expiratory flow rate. PEFR and MEFR, they are important to know whether there is a large or medium size airway obstruction. We can get to know the medium size or the smaller size. Mainly the gold standard investigation is going to be MEFR. Now, how to remember where the shifts are going to occur? If it is the restrictive lung disease, because the residual volume as well as total lung volume will be reduced, the graph is going to shift towards the right hand side. But there should be parenchymal disease. So, in the parenchymal restriction, the graph is going to shift towards the right. So, please remember, the right shift will be seen in the restrictive lung disease. In case of extra parenchymal lung disease, that means kyphosis, scoliosis, neuromuscular disorders like myasthenia gravis, obesity, pregnancy, in that case, lungs are absolutely fine, but because of some external factors, the person is having restriction in the inspiration. Because of that, the TLC is going to reduce. And he's having the problem or she's having the problem in the expiration also. So, RV is going to increase. So, the graph is going to shift inward. I told you X goes with in. So, please remember, if there is an extra parenchymal restriction, the graph is going to shift inwards. Alright. Now, what about obstructive lung disease, especially emphysema? RLD mein, the graph is going to shift towards the right. It is pretty simple. In the OLD, it is going to shift towards the left. But please remember, if it is emphysema, there will be specific pattern which will be seen. In the emphysema, the patient start to expire. Effort dependent part, he puts the effort. But during effort independent part, suddenly the flow is going to decrease. It looks as if someone took out the scoop out of it. So, it is known as scooped out pattern or dog-legged pattern. Alright. Why? Because suddenly the flow is going to decrease, and that's why there will be this pattern which will be seen. In both obstructive lung disease and emphysema, the shift is going to be leftward. In the emphysema, there is a specific pattern which will be seen. Obstructive lung diseases such as COPD, you can say the asthma, right? Bronchiectasis, all these diseases, the flow volume curve will shift towards the left hand side. Now, this is how it looks like. So, the dotted line is the normal curve. So, see, there will be left shift, but there will be no particular pattern. In the emphysema, there will be scooped out pattern which will be seen. That is the difference between asthma and emphysema. In the restriction, it is going to shift towards the right hand side, especially if the restrictive lung disease is parenchymal. Now, remember, X goes with in goes with X. The same funda is applied over here also, that if there is an intrathoracic obstruction, the expiration will be affected, and if it is intrathoracic obstruction, expiration will be affected. If it is a fixed obstruction, both will be affected. Please remember that.